Hello and welcome to Health Matters. My name is Sherri Gallant. I'm with Alberta Health Services. And as we begin the month of May, we're entering into Mental Health Week, which is the very first week of May. I am with David Gaubert. He is the Projects and Communications Coordinator with Canadian Mental Health Association for the region of Alberta South. Welcome, David.
Thank you.
So we're talking about Mental Health Week, and we should be talking about these things all the time, but is there a theme this year?
Our theme is Get Loud. We know that there's 1 in 5 Canadians who have suffered or are experiencing some sort of mental illness, and we want to let them know that there are great resources out there to access, not just during Mental Health Week, but throughout the year. And that includes here in Alberta South, where there's a variety of resources through different community organizations, through Canadian Mental Health, through AHS, that sometimes people just don't know where to turn.
And so how do you reach people and get them this information?
We have a great community that's behind us, and so it doesn't matter if it's a church group, the library, schools, wherever you're connected to already, chances are somebody knows where to access these resources. And people here in Canada are ready to start having a conversation about mental health. People are willing to reach out thanks to things like Bell Let's Talk Day and all of the other great initiatives that are out there. And people just need to speak up and get loud for mental health, and that's the best way to find the support. Whether it's calling the distress line, which is available 24/7 here in southern Alberta, or whether it's talking to somebody you already know.
So that's kind of exciting what I'm hearing you say. Am I correct that you get a sense that the stigma is starting to lift?
That is the goal, for sure. We're starting to see huge developments here in Lethbridge. We're putting in our Community Links program, which accesses people to resources, not just for mental health, but for housing and seniors and food and all those, whatever it is that you need, whatever is going to take that stress and worry out of your everyday life. We're actually implementing that with storefronts in the library and getting the booklets out to all the different organizations so that the whole community knows where to turn in a system that can honestly sometimes be hard to navigate it and you're under the stress of a mental illness.
So you're looking at the big picture.
Trying to look at the big picture for no matter what it is, at least there's an in point for somebody.
Yeah, because like you said, it's your whole life and all of the factors involved that affect your mental health.
Exactly. We want people living a life to the fullest, whether that's a meaningful daily activity, going to see a doctor, or whatever it is. We want them to get the best out of their lives.
You mentioned storefronts that you're creating or have already created at the library, both branches?
So the Lethbridge Public Library Downtown Branch and Canadian Mental Health are working together to set up the Community Links program as a storefront where people can actually go and meet with somebody face to face. So it's not just looking in a book or going online, but they can actually go down, and no matter what the question is, there will be somebody there to help them at any point in time during the library hours.
That's really cool.
Yeah.
So, and I was just going to ask you that, is it always during library hours?
We're going to choose the peak hours of the library and start small, and if there's a need for it, by all means, that's something we definitely want to know and want to expand if there's people accessing the service.
CMHA puts out a book that helps with access. Can you talk about that?
So the Getting Connected booklet is a little gray booklet that you can see. We give them out to schools, to workplaces, to employers, to just about anywhere in the community that requests them, that has a comprehensive guide of emergency phone numbers, but also profiles on services like counseling or food banks or education or outreach or housing. It doesn't matter. We try and capture whatever services somebody might need so they can have that book in their purse, in their back pocket, in their car, wherever.
That's really helpful.
Yeah.
So I think we're going to put, for our viewers, we're going to put the crisis line up on the screen.
Perfect.
And we'll put your phone number up on the screen if people want to, if they can't remember and they want to access to your resources and programs.
Awesome.
Anything else you'd like to add?
No, by all means, if people are feeling like the stress is too much for them, please just reach out. That is what we're here for. Not just Canadian Mental Health, but the great community that we have here in Lethbridge.
Wonderful. Thank you so much.
Not a problem.
Thank you for watching. This has been Health Matters.